Hello and welcome to Chapter 11. This chapter covers living with chronic illness. It goes over what chronic illness is and talks about a few specific chronic illnesses, including both the physical aspects of this illness and some of the psychological impacts. Chronic illness is defined as a long-lasting disease that can be controlled but not cured. So, when someone is diagnosed with a chronic illness, this chronic means that it can't be cured. It's long-lasting, or in essence, it's going to be there forever. This is in contrast to an acute condition, which is a condition, an illness that we come down with, we deal with, and then we recover. So when you catch a cold or the flu, right, you become sick, you treat this sickness, and then you recover. This is an acute disease. Chronic diseases are those that we never recover from. So these are things like diabetes. The medical system and most of our experience with illness focuses on acute conditions. So a lot of the way we conceptualize illness, the discourse we have in our society surrounding illness comes from the idea of an acute illness perspective, right? Illness is something we come down with and we deal with and we recover from. So this can impact people with chronic disease, and they kind of have to learn a new way to look at illness. Chronic illness can have a really severe impact on a patient, and it can really impact their entire identity as well as their entire lifestyle. Someone comes down with a chronic illness, that's really the psychological impacts of realizing that this is forever, right? If you have something like diabetes or Alzheimer's, this is going to significantly impact your life. It can impact someone's the way they look at themselves, the way they look at both their body and their personality, their self-image, as well as just their day-to-day routine, right? A lot of behavioral adjustments. Chronic illness has an impact on families as well. A lot of times when a family member comes down with a chronic illness, those who are closest, so those who are living with this person or interacting with this person on a daily or weekly basis, might have to adjust their own behaviors in order to accommodate this person's condition. As well as with some diseases, these people are going to take on a caregiver role, right? So this might have just been a spouse relationship, right, a husband-wife relationship, and now it's become a caregiver relationship, right? You have to care for this person with chronic illness in some situations. It's been found that when a family member or person has chronic illness, the most effective type of support that their family member can give is that support that is described as invisible. So this is when the family member of someone who is dealing with chronic illness provides support, but it's not support that is immediately visible and readily noticeable by the patient. So a lot of times when a patient that is dealing with chronic illness can see this support, they notice this support, that makes them feel bad about themselves, right? It makes you self-conscious about the support. But when family members are able to provide invisible support, this is really beneficial to the patient because they're getting that support without having to focus on it. Next, we're going to talk about a few specific chronic diseases and the impacts that they can have on people who have been diagnosed with them. First, we have Alzheimer's disease. This is a degenerative disease of the brain. While Alzheimer's can only be definitively diagnosed through autopsy, there's a number of brain imaging techniques, things like MRIs and CT scans, that can get close to 90% accuracy. So while we can't definitively diagnose someone until after they're deceased, we can get a pretty good idea through brain scans and looking at someone's symptoms. Alzheimer's has a number of characteristic symptoms, which include memory loss, language problems, agitation and irritability, sleep disorders, suspiciousness and paranoia, wandering, depression, and the ability to perform routine self-care. So, because the degeneration we see in Alzheimer's disease happens in the brain, it impacts our ability to function and to think and really to take care of ourselves, right? You're really going to see a lot of degeneration, which can be very distressing for both the patient and the family, right? A lot of times these individuals might not recognize their family members anymore. Someone who was once very independent, able to take care of themselves, might lose the ability to do this to the same degree, which leads to family members taking on a very strong caregiver role that they didn't have to in the past. Alzheimer's can be broken down into two categories, early onset and late onset. So early onset Alzheimer's typically occurs before the age of 60, and this is the type that is specifically tends to be tied to a specific genetic defect on chromosomes 1, 14, and 21. In terms of environmental factors, it's been shown that there are a number of protective factors. So people who engage in a lot of cognitive activity tend to have decreased risk. So people who are in careers that are very cognitively demanding, right? They have to do a lot of maybe math, a lot of processing, very cognitive careers. These people have a lower risk of Alzheimer's. In addition, lower levels of alcohol consumption can cut the risk fairly substantially. In one study, they even found that not consuming alcohol cut the risk in half. Next, we have diabetes. Diabetes is a disorder that is caused by insulin deficiency. In this case, the pancreas loses its ability to produce insulin, and patients are no longer able to regulate their own blood sugar. This can cause a number of health problems for patients, including cardiovascular disease, retina damage, and kidney disease. Unregulated diabetes can cause blindness, coma, and even death. So a diagnosis of diabetes can be very serious and really alter a patient's life. There's two different types of diabetes. First is type 1, which is insulin-dependent diabetes, and type 2, which is non-insulin-dependent diabetes. Typically, type 1 is going to be diagnosed fairly early on in life and is not going to be related to lifestyle factors. Type 2 diabetes used to be referred to as adult onset diabetes because this is a disorder that people tend to get later in life and can be tied with things like obesity. However, due to lifestyle factors, we see that type 2 diabetes is being diagnosed at an earlier and earlier age. The management for all types of diabetes requires lifestyle change in order for a person to adjust to their inability to regulate their blood sugar. So for patients with type 1 diabetes, we're often going to see that they need to rely on insulin injections. So even with an altered diet, for the most part, these patients are not going to be able to control their diabetes with just diet alone. They're often dependent on insulin. For patients with type 2 diabetes, we're going to see that our lifestyle factors are going to play a bigger role and can sometimes enable a patient to control their diabetes without insulin injection. So oftentimes, the best thing that a person with diabetes can do is to engage in physical activity and to alter their diet to include often lower calories and higher fruits and vegetable consumption. Health psychologists' typical involvement with diabetes is going to be finding ways to help people with diabetes manage their care through specific behaviors, right? So, when a patient receives a diagnosis of diabetes, this is often going to require some very serious behavioral changes, and health psychologists can often come in and help patients with these huge behavioral changes. Another chronic disease is asthma. Asthma is a disease that causes constriction of the bronchial tubes, preventing air from passing freely. Asthma is often thought of as a childhood disease because this disease tends to be more prevalent and more severe in children. So, a lot of individuals who have asthma are diagnosed fairly early in their life, and we see that the severity and the frequency of asthma attacks tends to go down as individuals get older. When an individual who has asthma experiences an asthma attack, their bronchial tubes constrict and the air can't get in. So it's really this kind of tightening of the respiratory system that prevents breathing. Asthma is likely due to a genetic vulnerability that makes the immune system respond with an allergic reaction to certain substances in the environment. So people who have asthma, they're going to respond to their environment more severely. So things like dust, right? If there's a lot of smoke in the air, their respiratory system responds with this constricting, right? Makes it hard to breathe. The last disorder that this chapter talks about is HIV, or human immunodeficiency virus, which, as we've talked about a few times over this course, causes the immune system to lose its effectiveness, leaving the body defenseless against a number of different illnesses. HIV can progress over a decade or more. So this is a chronic disease that people can often live with for a very long time. In the first phase of HIV, people experience symptoms similar to the flu, which can persist for a few weeks. In the next phase, people are likely to experience no symptoms, but this is when the immune system begins to be destroyed. As the immune system breaks down further and further, people begin to experience symptoms such as fever, fatigue, night sweats, loss of appetite, weight loss, persistent diarrhea, white spots in the mouth, and painful skin rash. As the disease progresses and the individual's immune system becomes progressively lower, this is when people are open up to a number of different illnesses because the body can no longer fight against these diseases. HIV is typically transmitted from person to person. This is going to happen during sexual contact, from mother to child during pregnancy or birth, and from direct contact with blood or blood products, which can include, used to be things like blood transfusions, although blood is screened properly now, so this is really no longer a risk. But this can happen through accidental needle sticks, IV drug use, and things like if there's an injury in an open wound and blood is present. The main role of health psychologists in HIV has been prevention by formulating strategies to change risky behaviors. So, because when it comes to HIV, people have a decent amount of control over their risk for HIV, right? Other than when this is passed to children from mother to child, we can take preventative measures, right? So things like engaging in safe sex, not using dirty needles, and taking preventative steps in the medical field, we can really drastically lower the risk of HIV. So health psychologists come in and really help craft strategies and campaigns to try and get people to lower this risk.